Hi there, my name is June and I'm going to demonstrate the principles of sterile technique in wound care. Sterile technique in aseptic practices maintain an area that is free from pathogenic organisms, separates a sterile environment from an unsterile environment. Proper sterile technique minimizes patient exposure to infection-causing agents, thereby reducing our risk. Anything we can do to promote our patient's health, sterile technique is a great way to do that and prevent risk. You'll hear me talk about the principles of sterile technique throughout the demonstration. But first I'm going to talk about, we discover we have to perform some wound care for our patient. I'm going to definitely want to check that doctor's order first. It's my most important first step. I want to see what the doctor has ordered specifically. Sometimes the surgeon has ordered us to not touch that sterile dressing for the first 24 hours and then to follow our typical wound protocol. Sometimes the surgeon wants to be the first person, he or she wants to be the first person that removes that dressing. And then sometimes we have issues when the patient returns from the operating room, maybe a fresh post-op wound, and maybe it's saturating the dressings, or we discover an issue, and then we need to contact the surgeon. But otherwise we follow the doctor's order. Then I'm going to check the patient's chart. I want to see any past history, the reason, the type of this wound is, if there's information in the chart about that, any allergies about latex or adhesives. Those are really important things to know. I also want to see if the doctor has ordered any pain medications for this patient. Wound care can sometimes be painful, and we want to provide analgesia at least 30 minutes before we're going to perform the procedure. So when I've checked all those things, I'm ready to go and introduce myself to my patient and identify the patient to make sure I have the right patient, and have a discussion, see where my patient is at, answer any of their questions. And so I'm going to now enter the patient's room, and I'm going to perform hand hygiene in front of my patient. That is so important. And I'm going to introduce myself and say, "Hi Jessie, my name is June and I'm going to be your nurse today. Can you tell me your full name and your date of birth? We need at least 2 patient identifiers." And so I'm going to compare the name band on my patient's arm as they repeat to me their name. So Jesse is going to tell me his name is Jesse Moore, and I'm going to compare that on the name band and see Jesse Moore. He's going to tell me his date of birth. It's April 2nd, 1998, and I'm going to compare that on the name band. And I can confirm I have the right patient. Then I'm going to say, "Jesse, I see you're back from surgery, or I'm going to be changing your wound today. Have you ever had a surgical incision before? Do you have any questions for me? This is what I'm going to be doing. Do you have any discomfort, or are you in pain?" And I'm going to answer all of Jesse's questions. And when we're all done and I've explored and he's explored or she's explored everything that we need to, then I'm going to say, "Is that okay?" And Jesse is going to either give me consent or not. And if he gives me consent, then I'm going to carry on and go and gather my equipment. So when we're happy with everything that has taken place with our patient, we feel good about that, I'm going to go and gather my supplies, and I'm going to return to the patient room. And so I've gathered my supplies. Here I am in the patient's room. And so I'm going to start applying the principles right away. Before I do that, I would just tell you that I would shut the door or pull the curtain, whatever the case may be, to provide privacy and maintain my patient's dignity. I would probably ID Jesse again just to make sure that I have the right patient. And then I'm going to start applying my principles. And so the first principle is that I really want everything to be above my waist. Anything below my waist is considered contaminated. And so in sterile technique, we want to do everything we can to minimize any risk. So then as I look towards my patient, I see that the bed is a little lower than the table. I can fix that easily. Again, I want my patient up as high as possible to maintain the principles of sterile technique, but also good body mechanics. Sometimes wounds can be a very big, long procedure, and your back can get pretty sore if you put yourself in a position where you're bending over. So you always want everything up nice and high. You can see I've created a bit of a triangle. I have a little table here behind me. That's strategic. I do that so that as I finish with each item that I don't need anymore, I'm moving it behind me. I'm always moving this stuff behind me so that when I'm done, I have a nice clear space to apply my sterile gloves while keeping my sterile field in view and my patient in view. So I'm going to first probably I'll speak to this. So I have turned down a cuff on this paper bag. If you're using a paper bag to gather the sterile gauze that you're using to clean in your wound and your dressing and your gloves, everything that you want to gather in this bag, you want to turn down a cuff so that when you're in the middle of sterile technique and you have sterile gloves on, you don't want your bag collapsing on you and then you have no place to put that infectious material or potentially infectious material. So always turn down a cuff. I've already removed some tape just to speed up things a little bit. I have 2 pieces torn away just to secure my bag to the right side of my bedside table. So that's strategic too. Everything that I'm showing you here today is a strategy for kind of your triangle of success. You never want to be reaching over your open sterile field, and so that's the rationale behind this being over here and me in this position so that I can reach from cleaning my wound safely across this space and into the garbage without reaching over my sterile field. Then I have torn 5 additional pieces of tape. That is to window in the dressing after I put it on, which I'm going to show you in a second. And then I've torn off a final, so I have 8 pieces of tape for this simple sterile wound. And that's to put my date and time and initial on the wound. We always label a wound that we've cared for so that the nurse coming behind us will know when that wound was changed and by who. So I'm done with the tape. There, I'm going to put that behind me. And you can see that I'm already in the habit of not turning my back. That's another principle. Once I start to open things, I don't want to turn my back away from my sterile field. So I could have looked behind me. My sterile field isn't open, but I'm just in the habit of not doing that. So I'm going to go ahead, and I've closed the curtain and provided privacy. I'm going to expose just the wound, just the area that I need to. And the camera's going to just come and get a little closer here while I put on my gloves. I'm going to perform some hand hygiene because we always perform hand hygiene before we put on gloves and after we remove them. And I'll speak to that and why we do that. We wash our hands before we put on our clean gloves because we don't want anything to pass through these gloves. They're not 100% impermeable to our patient. We wash our hands after we remove our gloves because anything that we touched we do not want to pass through to us. So the 2 pairs of clean gloves is also part of high quality, evidence-based care for reducing microbes. We don't know what is on the outside of that dressing, and so we don't want to use these gloves to touch that wound bed and transfer anything that may be on the outside of our gloves to the wound bed. So this pair is just for removing this dressing. And you can see that I have those pieces of tape, 1, 2, 3, 4, and 5, and then the 6th piece is my date and time. You can see that the nurse before me, it was me, I was here yesterday, dated, timed, and initialed that dressing. So the next thing I'm going to do is I'm going to start to remove this dressing. So as the nurse, you're assessing everything that you're doing. I'm looking on the outside of that dressing to see is there any strike-through blood, or is it saturated with drainage of some sort? Is there any redness? Is there any irritation around the peri-wound area or outside of the dressing area? And then I'm going to be very gentle as I remove that. There's a bit of a technique. One finger is lifting up on this tape. One finger is just gently pushing down on the skin. And that's just so it's much gentler. Adhesives are very strong, can be very damaging to our patient's skin. And so good technique reduces pain, reduces any kind of trauma to the skin. So we're just going to loosen it all around. I'm not tearing it off yet. I'm just loosening it. And then once I have the tape all loosened, I'm going to lift the dressing off with the inside facing away from my patient. Some patients do not want to see, it can be very upsetting for them to see what's inside of a dressing, so we just lift it off so that it's away. And right away I'm assessing what's inside of that dressing. I'm looking for characteristics such as type. Is it frank red blood, or is it serosanguinous, which is a mix of blood and serous fluid? Is it serous and just clear? Is it purulent? Does it have an odor? How much? And so when I'm done, happy with all that, I'm going to bunch that all up into my hand. I'm going to grab a mitt full of that glove, and I'm going to pull that glove right off with the dressing right inside of it. And then 2 clean fingers can reach under those gloves and just pull that right off, and I can drop that right into my receptacle. Hand hygiene. Okay. So as my hands are drying, I'm assessing that wound bed now. My hands are dry. I'm going to apply my second pair of gloves because part of my assessment is also palpating that wound. So we want clean gloves that don't have any possible risk of outside pathogenic organisms that could enter the wound bed. So as I come towards my wound, I'm looking first. I want to see, is there anything draining out of that surgical wound? A good clean surgical wound shouldn't have much coming out of it. There might be a little bit of dried blood that's left over just from when they were closing the wound at the end of the surgical procedure. Then I'm going to count my staples. That's going to be very important in my documentation, especially if I'm going to be the nurse or another nurse is coming after me in several days to remove those staples with the doctor's order. So I'm going to count all of those. I'm going to make sure that there is no dehiscence. So that means that the surgical wound is 100% approximated. There are no open areas, no drainage or descriptive characteristics in general. And then I'm going to look all around the peri-wound area. It would be normal to see a little bit of pinkish or deeper pink. There's natural or normal inflammatory response in wound healing, and so we would expect to see a little bit of inflammation, and that would be normal. And then I'm just going to palpate gently around the outside of the peri-wound area, all around those sutures, see what my patient is saying. Do I feel any induration or bogginess? Induration is a very hard feeling. Is it hyperpigmented and dark? That could indicate that there's infection brewing under the skin. And the same with bogginess. It could mean there's a pocket of exudate or drainage that's gathering somewhere under there. Is it hot and warm? All those things are all part of my assessment, which I'm going to document on my wound care flow sheet when I'm done. So I'm happy with that. I'm going to remove these gloves. I'm going to perform hand hygiene. And now I'm ready to go ahead and open my sterile tray and start setting up, adding my items, and then cleansing my wound. And we'll discuss these papers in the end. So the first thing I'm going to do is check my tray. I'm going to make sure that there's no punctures or tears, wet marks, anything that would indicate this barrier has been contaminated in any way. And I'm going to check the expiry date, that it was sterilized. When I'm happy with that, you'll notice that I have it pulled to the far left of my bedside table, and that is strategic as well. It's so that when I open up these big drapes, that I still have room to apply my gloves when I'm done. So I'm going to move my hand hygiene behind me because I don't need that anymore, and I have the rest of my items that I'm going to add in a second, and when I'm done, I'm going to remove anything to behind me. You can see I can reach behind me easily without turning my back. And so now I'm ready. I'm going to open this tray. It's moving much more quickly in real life, but for our demonstration today, it moves a little slower. So this is always the same. When we open a sterile field, you will always do it this way. The first drape is away from you. The second drape and the sides, they can go either side and side. And then you can see right here, there's another little tip for me to grab. And I'm going to just grab that little tip, and I'm going to bring it towards me as I take a step back, and those drapes are going to fall down. So everything below the table, that's another principle, is not sterile anymore. That's not sterile. In front of me here, you can't see it's not sterile, and in front of you, you can see what's hanging down below the table isn't sterile anymore. Now I have a new sterile field that I can see right in front of me that's on top of the table, and if you look all the way around where the blue drapes are, there's a 1 inch or 2.5 centimeter border all the way around that is unsterile. And so that's how we start to work and apply our principles. When we know those parameters, that's how we work within them. Inside the tray you can see a tool and you can see another drape. So everything is sterile there, but I'm going to pick up this pair of tongs, and I'm going to use those to open my drapes. So now I have an unsterile part to this tool, and I have a sterile part. So when I need to set this down, I'm going to set the sterile part well within the sterile part of the field. I have a 1-inch unsterile border right here, but the sterile part can be right inside there. I would set it down just like that when I needed to. Okay, so unsterile can touch unsterile, sterile can only touch sterile. That's one of our principles. So I'm going to pick this up, and then I'm going to open up the next drape that's inside. And so that next drape is again away, always away, and the next one is towards me. There. When I open up a very simple sterile dressing tray, you can see that there's a hemostat, there's a pair of forceps, and a pair of nurse's scissors. They vary depending on the type, and the little sterile bowl that you're going to take out and move just outside of the bowl and just close to you. I'm doing that to prevent spraying or splashing when I'm pouring my solutions in, my sterile solution, and also to make it a little more convenient for me. It's a little closer to me. You'll note that I'm still well within my sterile field and I have not breached this outside 1-inch unsterile border. So everything is fine in there for now. I can go ahead and set down my sterile inside the sterile, and the unsterile part where my thumb and my finger are well outside the unsterile. And now I'm going to add my items. So I'm going to start by adding my sterile solution, and you'll notice I have everything to the far right of my field as well, and that is strategic so that I'm not reaching over. That's another one of our principles. We never try to reach over. Anything could fall off of our sleeves, and so that's a way we prevent contaminating our tray. So I'm going to grab my sterile water, my normal saline, sorry, not sterile water, and I'm going to reach away from my tray, and then I'm going to read the label. I want to make sure I have the right solution that has been prescribed by the physician, and that is normal saline 0.9%. I'm going to check the expiry. It expires in 2022, so that's great, of the first month. And then I'm going to talk about a technique that we call lipping when our bottle has already been opened. So I opened this bottle yesterday. I dated and initialed it and put a time there so that the next nurse coming behind me would know that within 24 hours this is no longer good. So this bottle, when I'm finished this demonstration, would go in the garbage. It's done. It's been it's just at its 24-hour mark, and so we're going to get rid of it. So once I've done that, I'm going to move it to my dominant palm, label in, so that when I'm pouring, I don't let any spills come down and mar the label of this bottle. And I'm going to, because this bottle is open, I'm going to lip that neck. So I'm just cleaning it a little bit with some of the solution inside. So to do that, I'm just going to hold the cap in my hand, because if I put it down here, I would be contaminating it. I'm just going to tilt the neck towards my little garbage bag here, and I'm going to let the fluid fall into the neck, just slow, and then I'm just going to do a flick of the wrist. And that just cleans the neck of the bottle, any microbes that potentially were there. Maybe we just rinse them away, wash them away. Then I'm going to approach my tray from back here so that I'm not reaching over it any more than I need to. I'm going to tilt my neck, just be gentle. Not too high, but not too low. Don't let any part of your bottle touch the blue drape. And I'm just going to allow some fluid to fall in. And I'm not going to let anything splash there. And I'm going to put the cover back on. And I'm just going to, without turning my back, because that's another one of my principles, once this tray is opened, you cannot turn your back, turn your face or your vision off your tray. I'm going to reach and put that behind me. So next I'm going to add my items that are needed for cleansing and drying our wound. So for this simple wound, we're going to add 1 package of sterile 4x4 gauze. It has 2 in it. And so when you open up sterile packages to add to a field, there's a couple of ways that you can do that. I'm just going to show you the simplest way. I want you to peel down and hold those edges open, just like that. And that prevents it from flopping back and potentially contaminating something in the process. And I'm going to reach for my tool and I'm going to pull those out. I always open packages and be very careful to hang on tight to that package so that you're not going to drop it in your sterile field. And I'm going to just drop that in. I'm going to do the same thing with my sterile 2x2s. So there's 2 in every package of sterile 2x2s. I need 3 packages of these 2x2s, 3 to cleanse the wound and 3 to dry the wound. And that's a minimum. It depends on the type of wound that you're cleansing. You may need lots more. I'm just going to add those in. You notice I'm standing back from my sterile tray. I try not to reach over it as little as possible. Peel back my edges. Just pull that out, drop that in. So I'm going to take a double check and make sure I have all the things that I need in there, and I do, everything is good. So now I'm ready to put on my sterile gloves, and you can see I've made quite a nice space here for myself to apply my sterile gloves. It's nice and wide, so I'm going to come right to the end of my bedside table. I can still see my sterile tray. I can see my patient. This is happening much faster in real time, real life. So when we open our sterile package, and you can see in the other sterile gloving video a lot more in-depth demonstration of this. I'm going to move a little more quickly. I'm going to open up my package. You can see that it's telling me my right glove is here and my left glove is here. It's showing me on that picture that the thumbs are pointing up to me as well. That's important to know where your how your hands are going to slide into the glove. And then you can see it's folded at the top, it's folded at the bottom, and it's folded in the middle. Those actually also represent a 1-inch unsterile border when we open this package. So now I'm going to set that down, and I'm going to just fold back the edges. I've shown you this in the other video, so I'm going to move pretty quickly through this. I'm folding it back so it won't flop around and fold back in on me. And then my hands are reaching in here and opening up that package. And I'm holding on to the 1-inch unsterile border edge. See that fold? I'm going to give a little tug, just enough that it won't fold back on me. And so now I always pull up my sleeves so that nothing interferes. And I don't need to do any more hand hygiene right now because I just did hand hygiene before I opened my tray. But I absolutely will be doing hand hygiene when I'm finished. So I'm a dominant right-handed person, so I'm going to be applying my dominant glove first, and so you're going to do the same. And if you look at this folded cuff, you can see that it's folded all the way pretty much to the knuckle. If we were to put our hand over that, we can see that it's folded to the knuckle. When you apply this glove, I want you to try to keep that folded cuff at the knuckle line. Try not to let that go. So make sure your hands are nice and dry. Make sure you haven't chosen a glove that's too tight for you. I'm going to pick up my right-hand glove at the bottom of this cuff, because if you think about this cuff, it's going to be against my skin in a minute. So it's going to be unsterile in a minute on the inside of the glove, but not on the outside. So I'm picking it up here at the bottom. You can see I'm opening up a spot. Pick it up above the package, but keep it above the package so that if you drop it, it falls into the sterile package. So I'm going to pick it up. I'm kind of tucking my hand a little bit, and I'm just starting to fish it into the glove. And it should slide nice like that. Start to find the home for your thumb, and then turn your hand up to the ceiling so that you're not contaminating it accidentally against the edges of this package. Turn it up and just slowly start to slide your fingers in. Keep that cuff. Fold it right at the knuckle line like I just did. Okay? So now I have sterile fingers and I have a sterile glove. Sterile can touch sterile. But now I can no longer touch the edge of this cuff because that's going to end up near my skin. So you have to think about what you're doing when you get to the second glove. I'm going to hold on to the unsterile 1-inch, 2.5 centimeter unsterile border that I'm allowed to hang on to so the package won't slide around on me. And then I'm going to use my fingers to loosen that cuff. I'm pushing my knuckles against the glove, or the fingered area of the gloves, while I loosen the cuff on this so that I can get my fingers underneath it. It just takes a little bit of practice. It's a sticky one. Once I have my 4 fingers inserted into that cuff, I'm going to lift it up off the package. You can see the fingers are kind of flopping down there, and I've got this part open to scoop my hand in. So I'm going to start to fish my hand in, and I'm going to abduct my dominant third thumb on my right hand away so that I won't risk contaminating it against my skin on my left hand. I'm going to turn my glove up, and I'm going to start to find my home, and my dominant hand is stationary. It's not moving, it's just pulling down. My thumb is abducted. This hand is reaching to the ceiling and just making a wave, and it should be very smooth for you. You can see I'm not letting my thumb come and touch any part of my arm. I'm just pulling that down and then just gently let go. These fingers can now reach inside of this cuff. I'm abducting this thumb now to make sure it does not run against this arm. Reach my hand up, just wave, and let go. Put your hands together when you're done so you don't risk contaminating them on anything. Leave that package, it's not hurting anything. Come over here, take a second, and just think about what you're going to be doing. And think about these gloves now. They're sterile. Sterile can touch sterile, but you don't want anything else touching these gloves. You don't want these gloves touching any skin, anything else except your sterile field. Okay? So I'm going to separate my sterile can touch sterile, so I can touch this all as much as I want inside now. I'm just going to separate those so that when I'm ready to redress my wound, they're ready. I'm going to separate my 2x2s. There's 2 in each one of those packages. So I'm just going to separate those. I need 3 for cleansing and 3 for drying. And in a second, I'm going to show you how to make a little pillow. So just separating those. Now I'm going to grab my forceps, and I'm going to grab my hemostat. I'm going to use my hemostat in my non-dominant hand as a tool for securing. I'm going to show you how to make a little pillow, and the camera's going to zoom in here and get a real close view of that for you. So I'm going to grab my first 2x2, okay, and I'm going to just move my bowl this way just a little, I'll move it this way just a little bit so that the camera can catch what I'm doing. So I'm going to take my first 2x2, I'm going to set it right down here. It's still well within my sterile field, and I think the camera can pick that up well. And so this is going to be my anchoring tool, this hemostat. So you can see how I'm holding it in the palm, and then kind of like a dinner knife, my thumb is the power, and my index finger and my thumb are the power. So I'm going to start by pulling the 4 corners in to make this little pillow. There's different ways for you to wrap your gauze, but I'm going to show you the simplest way. So you can see then my anchor comes and holds that point. I'm going to pull the next point in, and I'm going to anchor it. And then I'm going to pull the next point in, and I'm going to anchor it. And so when I've pulled in those 4 points, then I'm going to grab the whole thing with my forceps, and then I've created a nice little pillow. And the rationale behind that is we don't want this forceps, any part of the steel tool, to be rubbing against our patient's sutures or staples or against their wound bed. That would be painful, and we don't want to do that. So now I'm ready. I'm going to keep this tool in my hand. I'm keeping my hands well above and in front of my face. I can see everything that's moving, so you can see this motion that I'm going to be, you can see how it's safe. I can drop my stuff in when I need to. So now I'm ready to start cleansing the wound, and we cleanse from the least contaminated to the most contaminated. The least contaminated part is what I like to call ground zero. It's the very center, or the wound bed itself, the suture line, the staple line, the inside of the wound bed, that's ground zero, that's the least contaminated. And we work our way out. So it might be in a circle that we're moving, it might be straight up and down, and we're moving in layers away. That's how we work with our wound. We clean from least contaminated to most. So I'm going to dip my 2x2 into my normal saline, and I don't want it to be saturated, so I'm going to just rim it around that bowl so that it's not too wet. And then, as I head towards my patient, I'm going to start at the least contaminated, so right down that staple line. I'm going to start at the top, and I'm going to apply gentle pressure, but you must apply pressure, and I'm going to roll all the way down. One movement, no dabbing, you never go back over that, one swipe. And I'm keeping my forceps down, pointed down, as I head to the garbage can, because I don't want any fluid that I just touched that wound with to run down onto my sterile gloves. So I'm keeping that pointed down, and I'm dropping that gauze high above that garbage bag. You can see how I'm keeping everything very high above. And that's your goal in sterile technique. And I'm going to do that 3 times. So I'm going to make my next little pillow. And now I'm going to go farthest away from me. So the next one is on the other side of that staple line. And I'm applying pressure and I'm cleansing. I'm applying pressure to remove microbes, and I'm coming all the way down. One swipe, and then I'm keeping my tool pointed down, my forceps. I'm not reaching across my sterile tray. I've got my hands up nice and high in the air, and I'm dropping that gauze into the receptacle. The next one is going to clean closest to me. So I'm making my pillow. And now I'm going to cleanse closest to me. One movement, one swipe. No going back over the area. I'm moving now towards my receptacle. I'm not reaching over my tray, and I'm dropping that. Now I'm ready to dry my wound, and so I'm going to grab my little 2x2s again, and I'm going to repeat the same process. Exactly the same thing that I did for cleansing is exactly what I'm going to do for drying. So the first one is going to go right from the top at ground zero, least contaminated. One movement all the way down, keeping my hands up and dropping that. Now I'm going to dry farthest away, so start right at the top of that staple line. Apply gentle pressure and one movement all the way down. I'm not reaching over my tray. And then my last one. I'm staying well within my sterile field on this blue drape that you see. I could have also done it inside the tray if that was more comfortable. My last one is closest to me, starting right at the top and moving all the way down in one movement. Staying away from my sterile tray. Hands are up nice and high above that garbage can. I don't want to see you down here. I'm dropping that in. So our cleansing and drying is completed for our simple surgical wound. So I can drop that in here. And now I can do a couple of things. Now I can use my fingers to apply the new dressing, or I can use the forceps. I'm going to choose to use my 2 fingers. They're clean and sterile. There's nothing wrong with doing that. And just remember this, when you come over to drop your dressing down, once it's fallen, that's where it stays. So just take your time so that it's nice and neat and tidy, and just let that fall down. And pick up your other one and overlap that dressing. There's lots of dressings. We just chose this simple one for you, so that didn't come out perfect, but that's okay. And so now that wound is covered. Sterile technique is complete, so you don't need these sterile gloves on anymore. If you want to use your sterile gloves you want to leave them on to tape your wound, you can, but it's difficult. So I'm going to remove them. I'm removing them by grabbing a mittful in the middle. I don't want to touch anything that's on them. And I'm pulling it off. I'm reaching 2 clean fingers under here. I can do a little hand hygiene if I want to. and I'm going to start windowing in that dressing. I'm going to start right here and just close that side, but if you started on that side, it wouldn't be wrong. And I'm just going to window in this dressing, so I'm closing off all edges. I don't want any air getting in there. So you can see 1, 2, 3, 4. I'm also closing off where the gauze is overlapping. That's very important. We don't want any air getting in. And then my final one is one that I have already. It's my date and my time and my initials. That goes again to the right side so that when the next nurse comes in, she's going to care for Jessie from the right side of Jessie. She wants to be able to see that right here. So we're going to apply that right there. Okay, I'm going to perform some hand hygiene again. And then as I begin to clean up my area, talking with Jessie, I'm going to cover Jessie and make sure that I've returned him to a comfortable position. Make sure he has the call bell handy. I'm going to ask him to describe for me if he's okay, if that was difficult for him, if he had any pain. And what's really, really important as I finish off this skill is that I document this really well. And so you're going to take out your wound documentation assessment sheet. Now you're going to start to fill in all the things that you've seen, smelled, counted, palpated, and you're going to document all those things, your number of staples or sutures, any redness, anything that you've seen. Then you're also going to describe exactly what you cleanse the wound with, what you redress the wound with. You never document that you perform wound care as per protocol. You document everything that you did, seen, and everything that your patient experienced as well. Okay, so that concludes our demonstration of the principles of sterile technique in wound care. And for help when you're viewing this video, I want you to print off the wound care checklist that is up on the Moodle site to help you as you continue to watch this video and develop the skill, and then come to class and we'll do it together. Thank you.